Welcome to the Montachusett Public Health Network meeting. This is the May 28th, 2025 meeting. I now call this meeting to order again. Please be advised that FATV is conducting an audio and video recording of this meeting for public broadcast. I ask that anyone in the audience is recording this meeting to please identify themselves for the record now by standing and stating your name and city of residence. Seeing none, at this time I ask that all electronic devices be put into silent mode. Since we do not have a clerk, I will do the roll call. And may I have a copy of the agenda? So let's do the roll call. Athol? No one from Athol. Phillipston?
Present.
Westminster?
Present.
Winchendon? Princeton?
Present.
Sterling? Royalston?
Present.
Templeton? Gardner? I know you're present. It's Leominster.
I'm here.
Leominster is present. Fitchburg is present. 1, 2, 3. Oh, Clinton. Sorry about that. No good. That's pretty good. If there is anybody in the audience that wishes to speak, you may now approach the podium and identify yourself, and also identify the item on the agenda to which you wish to speak to. Is there anybody in the audience that would like to speak? You may now step up to the podium. Is there anybody virtually that would care to take 2 minutes to speak? Seeing none, we will move on to the agenda. The first item on the agenda are the meeting minutes. Has anybody reviewed the meeting minutes?
Move them.
Okay. We have a motion from Phil. If I may make an amendment proposal, do you want to keep your motion, Phil?
Did it get seconded?
There was no second. If I could go back and have a discussion about the minutes, I think there is a line actually missing in the minutes, and if I could make a proposed amendment, the minutes basically.
Fine.
What was missing and was the actual wording says Steve reviewed the shared budget line item spreadsheet line for line. What was missing, and I propose to make a motion to amend, is that Phil moved to approve the budget report, Michelle seconded, and all were in favor by roll call. You want to remove your motion, Phil, and start over?
Oh, I mean, it didn't get seconded, so, I mean, move the minutes. We need to get a second.
Is there a second?
Anybody?
I second.
Thank you, Terry.
All right.
Now, I make a motion to propose the amended minutes.
Well, you're talking about the minutes, so we look for deletions, additions,
Yes.
corrections. So it's just a simple correction.
Is there any objection to it?
No objection.
So, any further discussion on it? None. Okay. We got a motion and second that the minutes passed as amended. Next item on the agenda,
Did you have a vote?
yes.
We all said aye?
No, I made it up.
You need a roll call vote?
Oh, okay, roll call vote, thank you. Fitchburg, I make a motion to approve the minutes as amended. Leominster? This is painful, folks.
We have our
Second,
coffee this morning?
Gardner?
Aye.
Clinton? Sorry, I'm next on Clinton. Phillipston?
Leominster is aye, sorry.
Phillipston, aye.
Westminster?
Aye.
Templeton? No Templeton, sorry. Royalston?
Aye.
Princeton?
Aye.
Hubbardston?
Aye.
And no Winchendon still, correct? Okay. Motion passes unanimously. Sorry for the confusion. Next item on the agenda is the PHE work plan discussion. We are in the process of preparing our work plan for FY26. I guess what I'm searching for are folks interested in being a part of the work plan for the FY26 fiscal year. Maybe we have a discussion on how we put the work plan together. Either we work together as a subcommittee, maybe we can send a survey and have people vote how they would, if they wish to take part in it. We could dedicate a meeting to it, maybe a June meeting before the end of the fiscal year. Anybody have any discussion on that? Don't all yell at once. Okay, Phil.
But just send out a survey, see who's willing and what entail. Is this the work plan for the shared services?
It is the work plan for the Public Health Excellence Grants. So it involves quite a few items, including workforce standards. Anybody want to help me out there? Performance
Performance
standards?
standards, yeah.
Yeah. So it's,
As far as we know, we're still funded.
as far as we know, we are still funded, yes.
And I would assume and see if you can get anybody to have some time.
Anybody else have any comments? Just as I thought. Survey it is. Okay, moving on to the agenda item. At this time, I would like to introduce our regional inspector. He's actually been with us for a couple of years now, but has been covering at the Fitchburg-Westminster landfill due to absences. But I wish to introduce Peter Delorme. If you wouldn't mind stepping up to the podium and saying hello to the folks, just to...
Good morning, everybody. Peter Delorme, Regional Health Inspector, MPHN. Nice to meet you all, and I'll be seeing some of you real soon, I'm sure.
Any questions for Peter? It's a talkative group today. Okay, thank you, Peter.
Thank you, everybody.
Right
Have a
along.
great day.
And we do not have Victoria. Why don't we jump into, oh, she is.
Here.
I apologize. Victoria, the floor is yours for the infectious disease updates.
Hello, Director Curry. Hi, everybody. It's nice to see you. Welcome back, Abby. We're so happy to have you back. I just wanted to provide an update on some of the things that we have been working on the Epi front in the first quarter of the calendar year, and also for some updates since the beginning of the fiscal year. So a couple of things. The first thing is, as many of you are aware, we have successfully established as a Vaccines for Children, otherwise known as VFC, provider here in the MPHN. And so what that means is that we are able to receive pediatric routine immunizations free of charge from the state and administer them to our entire pediatric population age 18 and under. So I have been reaching out to many of you, especially our larger communities and many of your school districts, letting you all know of this new opportunity we have in the MPHN. I would encourage you all to take advantage of it. Since this happened around September or so, and since September we have successfully administered about 850 pediatric immunizations here in the MPHN. That does not include any flu or COVID doses, just for clarification. So it includes vaccines such as MMR, polio, varicella, Tdap, all of those vaccines that are on the routine PD schedule and are required for school. So I will remind all of you guys again that if any of your school districts are having challenges with students needing pediatric immunizations and they are not linked into primary care yet, I would encourage you to reach out to me and see how we can help. Also on that front, shout out to Leominster High School, who has made some really significant strides on getting their high school students there up to date on their immunizations. So congratulations to Leominster High and to Leominster, so yay. So does anybody have any questions on that? I see a thumbs up from Phil. Excellent. All right, very good. The next thing, while we're talking about vaccines, is our flu clinics. Believe it or not, it is that time of year already where we are going to start to think about flu season in the fall. As we did last year, we will plan to host flu clinics at all of the places that we went this previous flu season. And so we will work on scheduling those in about June or July once all of the final vaccine recommendations for the fall are released. If there are any towns who didn't have a clinic in your town last year, or you would like a clinic hosted at a place in your town that did not have a clinic in the past, please let me know and we would be happy to schedule that and get you guys on our calendar. Phil has already reached out asking for a flu clinic in the fall, so he is way on top of it. So yay, Phil, good job.
And we're going to have COVID too?
The plan will be to offer COVID vaccines if COVID vaccines are recommended, yes. But the official COVID vaccine recommendations have not been released by the CDC yet, so we will have to wait to see what happens with that once that's available. But yes, if they're recommended, we will have them.
We still have a CDC?
As of now, we do have a CDC, yes. Maybe not tomorrow, though. We'll see. Does anyone have any questions on flu?
Any questions for Victoria?
No. All right. Moving on to the next thing. We are also heading into the summer, and our sunscreen dispensers will be returning to public parks and pools in the MPHN once again. I have started to reach out to each one of you individually to talk about our sunscreen dispensers and the placement of them. So if you haven't heard from me yet, you can expect to hear from me soon. Unfortunately, the weather has been a little not great in the past couple of weeks, but hopefully it will get better and people will start to be able to spend some time outside. Does anybody have any questions on our sunscreen? Phil?
Ours are out. The campground in the library. Oh,
Yeah.
just so you know.
Yes.
I tried out.
Yeah, I know that we missed collecting those two dispensers at the end of the season. So yeah, Catherine and I were talking about.
Are they already out?
They're out. Yeah, that's what he just said.
Oh,
yeah.
they're functioning, Phil. Let us know if they need maintenance. We'll come up.
Or you should make a check and
Yeah.
make sure you have like extra bags for them.
Yeah. Yeah.
We do, yep.
Oh,
Yep, we'll come
just,
up and maintain them, yeah, and check them out. Sure.
Tully Campground's open, and then the library has, their hours, so don't come up on a day the library's closed.
Yeah,
so.
I have to check that schedule. I never remember what days they're open, but yeah, in Tully, they were closed when I went up there to grab that one, and they were closed before I got there, so.
They're open now.
Open now, excellent.
So,
All right.
Any
Very
other
good.
discussions?
Okay. I have 2 or 3 more items. 3 more items, but I'm moving along here. The next thing is blood drives. We have a blood drive scheduled here in Fitchburg in just a few weeks, and I wanted to put it out there again to the MPHN that if any of your towns are interested in hosting a blood drive, to please reach out and let me know, and I would be happy to coordinate a blood drive through the Mass General Hospital Blood Mobile. So if that is something that you are interested in your town, please let me know, and I'm happy to get that scheduled and work on that with your community. Any questions on blood drives?
What day is it? June 6th?
No.
June,
I want to say it's the 17th.
okay.
I think it's the 7th.
Apologize.
No questions on blood drives? No? All right. The next thing is lead poisoning. So we have continued on the pilot project that we are working on with the Childhood Lead Poisoning Prevention Program, also known as CLIP. And so as a reminder, what this pilot project is the MPHN providing community health worker services to children in our region under the age of 6 who have a blood lead level of between a 5 and 9 Venus. This is a bit of a tongue twister. So we have continued on our pilot project with CLIP, and it has been quite successful. We have provided community health worker services to 38 children since the start of the fiscal year, which is July 1st. And I am happy to report that for all 38 of these children, all of them have had decreasing blood levels after we have worked with the family and provided them with services. So I think that this is making quite an impact for our families that are facing challenges like this, and we are happy to be able to continue. Shout out to our community health worker, Cynthia, who does an excellent job with these families and is very thorough in making sure all of the appropriate education is provided. So well done, Cynthia, and we will continue on with this project. Does anybody have any questions? All right.
I think it's important to note that the record of Cynthia with these elevated or cases, I think it's important to report that
100%.
100% of them have not
Poisoned.
reached the poison level or 10 or above, yeah.
This program, this pilot project with CLIP started September 2023, and while I just mentioned to you all that none of our patients since the start of this fiscal year have become poisoned after us providing services to the family, that is the case for every family that we have worked with since September of 2023. And I believe that number is around 85 or so, just off the top of my head. So as I mentioned before, that is quite the success, and I think it's something that CLIP is looking to expand to other communities because of how successful this has been for our SSA. So I'm really proud to share that data and really happy to be able to continue with this project. And again, well done, Cynthia. She's amazing with the family. She really is.
Any other discussion? Any more items?
I have one more item.
Yeah.
The last item I have to share an update on is with Maven. So just wanted to share some data since the start of the calendar year, the first quarter of our calendar year here in 2025. As it has been in the past, our most common reportable disease that the MPHN has investigated are enterics. We have had 56 enteric illnesses reported since January 1st of 2025. And with each one of these, there is a case investigation that goes with it. We have had norovirus, 22 norovirus cases, the most common. I did exclude norovirus cases in long-term care facilities as to not make the numbers seem larger than they are in the greater community. 21 Campylobacter cases, 7 Giardia cases, 3 Shiga toxin E. coli cases, and 3 Salmonella cases. So that is not uncommon, that our most common reportable illness that is investigated in MAVEN is enteric. We have also had 7 invasive group A strep cases in the community. We have also had more invasive group A strep cases in long-term care facilities, which I again excluded as to not make the data seem different in the community than it is. We've also had 6 tick-borne cases since January 1st, and I would expect those to greatly increase in the coming months. Myself, I got home from work last night and had a tick crawling in my bed and a tick crawling on my couch, so that's not a good sign. I hope that I do not end up in our workflow with my own tick-borne illness. And we have also had a couple of one-off cases, which for patient privacy, I don't want to share the illnesses that patients have been diagnosed with only one case. But these include things like vaccine preventable diseases such as pertussis, which has greatly decreased in this calendar year compared to last calendar year, which is quite the positive sign. And also some illnesses such as malaria. We also have had some cases of active tuberculosis, which I'm going, again, to leave out the specific number because of patient privacy reasons, but it's under 5. And those active tuberculosis cases are being managed by a contracted nurse that we are working with. She is a part-time employee of UMass Memorial. She works at the Hospital at Home program and is really excellent at doing home visits with these patients. So shout out to our nurse, Ashley, for doing a great job with those. She's with a patient now. I wanted her to come and meet you all, but she got caught up on another home visit. So that is the update with MAVEN, and I believe that is my entire list. Does anybody have any MAVEN questions or any questions about anything else?
Just, you report those to each individual town, correct?
So each of the cases are investigated, and all of our towns have MAVEN access. And if you would like me to report to you when each of the individual cases are investigated, I'm happy to do that. Just let me know. I know there are certain towns that we do not cover MAVEN for, which include Hubbardston, Leominster, and Clinton. Those towns' data are not included in these data that I just presented because the MPHN is not doing that MAVEN coverage. Mm-hmm. And, you know, we cover, like, I'll cover for Stacy when she's at a conference or on vacation or whatever it may be. But yes, if any of you would like each individual MAVEN case reported to you, then please let me know and I'd be happy to do that.
Any further discussion, questions, concerns?
I will say when there are situations in a town that are less routine than something like a tick-borne, for example, then the town immediately knows what happens. Particularly Gardner comes to mind. We have had several instances of less routine reportable illness issues in the past year, And Micah and I have become good friends for that reason. So I'm really sorry for that, Gardner. But yes, if you ever have something that is unusual, you will know about it right away.
You're doing a great job, Victoria, so thank you.
Thank you, Micah. I'm really sorry, but Gardner, it's going to get better. Don't worry.
Yeah, it's okay.
Excellent. Any further discussion? Thank you for the very detailed and thorough report, Victoria. As always, moving on to the agenda, I'd like to introduce Kyla. If she would step up to the podium. And she is going to show us the FPHS Data to Action Plan.
Okay. Hi, everyone. My name is Kyla Botsian. I am a consultant with BME Strategies, and I've been working with the Department of Public Health's Office of Local and Regional Health to roll out this Foundational Public Health Services Shared Services Review. And today I'm going to share the preliminary results for MPHN. So for all of the municipalities in your shared service arrangement that completed the shared services review. This is just some preliminary data at the shared service arrangement level. And then also on the Zoom today from the Department of Public Health is Ileana Carrion, who is the program coordinator for your region, as well as the rest of Western Massachusetts. And so she's here on behalf of the state as well on Zoom. And then also this shared service arrangement received support from a subject matter expert, Doug, who's also here in person today, so he can answer questions maybe if there's any specific to the communities that he supported with in the tool. Okay, great. My screen hopefully is sharing correctly. So this is the agenda. We'll go through the purpose and then discuss some of the preliminary data and then review the data to action toolkit. So the purpose of this presentation today is really to just show some of this preliminary data, and I want to just reiterate that this is all just meant to be informational, and it's not an assessment in any way, shape, or form of your shared service arrangement. The implementation of the Foundational Public Health Services Framework is a stepwise process that the state knows will take a really long time to fully implement in Massachusetts. And data from the FPHS Shared Services Review will be used to inform the development of a timeline for this overall implementation process. So the purpose of this presentation is to provide actionable insights that align with long-term capacity building goals, including identifying areas for increased shared services with an emphasis on meeting some of the foundational, with an emphasis on enhancing some of the foundational capabilities that are outlined in the framework that I'll show in a later slide. And then the goal is just to understand how you can use this data to help in planning and capacity building moving forward. And so here, oh, not working. There we go. This slide shows the Foundational Public Health Services Framework. So this framework was developed by the Public Health Accreditation Board in collaboration with public health folks from across the country. So this is a national framework that has been adopted in several states across the country, and it was recommended for adoption in Massachusetts in the Blueprint for Public Health Excellence, and it was also written into the SAFE 2.0 legislation. So this framework is made up of 5 foundational areas, which are shown in the teal circles on the screen. And these are really core public health functions and programs. These are things that we typically think of when we think of public health in our communities. So like environmental public health, which includes things like inspections, and then communicable disease control, which is things like vaccinations and things like that. And then there are 8 foundational capabilities, which are shown in the navy blue rectangles below that. And those are the things that really enhance those services that are typical of public health. So this is things like community partnership development and emergency preparedness and response. And so moving forward into fiscal year 26, the goal is to enhance these foundational capabilities in order to then improve your delivery of those foundational areas. So in this presentation today, I'm only going to be going over points 1 and 2 in this table of contents, but I'll share the presentation, the whole presentation with Catherine after, and she can make that available to anyone who wants it. And so included in the presentation that will be sent later on, there's a data interpretation guide that will explain how to look at each of the figures that are presented in the presentation. And then there's also a data appendix if you're interested in looking at some more details about the data, broken down by the headline responsibilities that fall under each of the foundational areas and capabilities. So it's just a little bit more detail about each of the things. So now I'm going to go into actually sharing some of the data, and all of this is presented at the shared service arrangement level, so there's no like town names listed or anything like that when we're looking at the data. So this slide is just showing that all 13 communities in MPHN completed both the service delivery tool and the cost tool. I don't know why it's not showing the right slide. Okay, there we go. So you completed, all of you completed both tools entirely, so all of your data will be included in this presentation. And for those who didn't work on completing the tools, the cost tool collected data on your FY24 revenue and spending data. So all of this is about fiscal year 2024. And then the service delivery tool collected information on the services that are delivered by individual municipalities, health departments, as well as the services delivered by the MPHN staff, again in FY24. So in fiscal year 2024, MPHN and all of its member municipalities received a total of 7 grants, and the total spending across the shared service arrangement, so this is including MPHN spending and spending from each of the 13 municipalities, was $9.95 million, and 9% of this spending was from grant dollars. And then $91,000 of this total $9.95 million was spent on what's called community-specific services. So these are services that fall outside of the scope of that foundational public health services framework. And so these services include anything having to do with like trash or recycling. So any towns that have transfer stations, the spending on those sites is included in these community-specific services spending. There were several occupation categories that were accounted for in your spending. So the spending accounts for all staff costs as well. And there were 7 occupation categories that were made up of shared staff. So folks that served more than one of the municipalities in MPHN. Some of these occupation categories include local public health leadership, and your EPI is shared, nurses are shared, some shared inspectors, and a shared services coordinator. Are there any questions about this slide? Okay.
Phil has a question.
Oh, sorry, Phil.
Can you go back to that slide right before that showed the difference on spending, you know, with the green versus the gray?
Yeah, sorry, it's taking a minute to go back to it. I don't know why. Okay, there we go.
So green, well, there you go. Green is the municipal funding, that's correct, and the rest is grant?
Yes, that's correct.
But then in the chart, the FTEs, is it still where the green and gray is the grant?
No, so the grant versus grant dollars versus non-grant dollars is shown in the, I don't know why it's like freaking out on me, sorry. Please hold. Okay.
Yeah, so which one is which?
Yeah, so the grant versus municipal dollars is that upper left-hand corner one,
Yeah,
the circle.
And on the right.
And then, yeah, on the right-hand side, this is not separated by grant versus municipal dollars. This is separated by shared versus not shared. So the darker color is representing FTE that are shared across the communities in MPHN, and then the lighter gray color is the FTE that are for like an individual municipality. So if there's a town that has their own inspector, for example, that would fall under the 11.3 non-shared environmental health workers. Does that make sense?
Okay. Yeah.
Okay. Okay, so then this slide is looking at the total spending by foundational public health services, foundational areas, and capabilities. So this is taking out the spending on community-specific services, so anything related, again, to trash or recycling. And your highest spending category is in environmental public health, and then your highest FTE category is also in environmental public health. So you're dedicating the most staff time as well as the most money to environmental public health services across the shared service arrangement. Which makes a lot of sense since environmental public health is the foundational area that aligns most closely with the current performance standards. So it essentially is saying that you're spending your time and money on things that are working to meet the current performance standards and do the job that local public health in Massachusetts has typically been asked to do. And then the next part of the presentation, I'm going to go into a little bit more detail about two of the foundational areas and capabilities. So we're going to look more closely at environmental public health and assessment and surveillance. But before I do that, are there any questions about this overall spending? No? Okay. Oh, I actually lied. The next part is talking about capacity and expertise. Sorry. I'm not used to presenting in person, so it's making me nervous. So this slide is, I don't know, okay, perfect, is looking at the capacity and expertise of the shared staff and the local public health entity staff. So in the service delivery tool, staff were asked to indicate their capacity and expertise to deliver each of the foundational public health services, foundational areas and capabilities. And so this chart is highlighting the areas and capabilities where the shared staff indicated having the highest capacity and expertise, and then also where they indicated having the lowest capacity and expertise. And then the same is shown for an average of the 13 communities' municipal staff. So we can see that the highest areas and capabilities for the shared staff are in equity and access to and linkage with clinical care. And then the lowest areas are in maternal, child, and family health and accountability and performance management. And then for staff in individual municipalities, the highest capacity and expertise areas are emergency preparedness and response and environmental public health. So once again, showing that you all are really strong in environmental health and have the staff to support those services in your individual communities. And then the lowest areas for individual towns' staff was in access to and linkage with clinical care and maternal, child, and family health. And then the next three slides are going to show this data just displayed a bit differently for folks maybe who understand it better in a different way. So this slide is showing a scatter plot of the capacity and expertise of the shared staff. So once again, we can see that equity and access to and linkage with clinical care are higher up in the right-hand corner, which aligns with more comprehensive capacity and expertise. And then in the bottom left more side are things like accountability and performance management. And then this slide is showing the average for the 13 municipalities in MPHN and their reported capacity and expertise for each of the foundational areas and capabilities. Once again, with emergency preparedness and response and environmental public health being two of your strongest areas across the shared service arrangement. And then this next slide can look a little bit overwhelming, but it's my personal favorite. So this one is showing by foundational area and capability the capacity and expertise of the local public health staff compared to, or next to, the capacity and expertise of the shared staff. And so we can see areas where the shared staff are really working to support the municipal staff where their capacity and expertise is really limited, like in assessment and surveillance. We can see that the municipal staff really don't have any capacity and expertise in that area, but the shared staff for MPHN do have capacity and expertise in that area, so they're able to provide those services to all 13 of the communities and really meet the needs for you all. And same thing kind of for organizational competencies and equity, where the shared staff are able to enhance those services for all of you. But then in areas like communications and environmental health, it's more the responsibility of those individual municipalities to deliver those services, and you all have the capacity and expertise to do that at the municipal level. Any questions about this capacity and expertise? And then now is when I actually will transition into the two foundational areas and capabilities. Oh, my goodness. Okay. Thank you.
More work, Mom.
30.
Still giving you trouble?
Huh?
Is it giving you trouble?
Oh, no, I just was skipping to this slide, so it was taking a second. But so this is the environmental public health data, and so the reason that we're looking a little bit more in depth into this specific foundational area is because this service is generally provided by the towns in your shared service arrangement, but there's also support from the shared service arrangement or from MPHN if the municipalities need it. So in FY24, you only had a shared inspector for half of the year, which is why the capacity and expertise of the shared staff, which is shown in that purple dot or purple square in that middle figure, that's why it's lower. But in fiscal year 25, and hopefully in fiscal year 26, it will be even higher because that shared inspector who introduced himself earlier will have greater capacity and expertise to support all of the communities. And so the availability of that shared inspector in fiscal year 24 will he's more available than he was in fiscal year 24. So that will help the towns even more in the future. But in fiscal year 24, local public health entities and MPHN dedicated 64% of total spending and 40% of staff working hours to environmental public health. So this was your, again, highest spending category and highest FTE category. And in the figure on the bottom left-hand side, that is looking at who is responsible for the delivery of these environmental public health services across your shared service arrangement. So the darker purple color indicates that in that far left column that says LPH, is showing that most of the municipalities are responsible for delivering their own environmental public health services to their communities. So you all have your own staff in your municipalities who are providing these services. And then the center column that says SSA is indicating the headline responsibilities that the shared service staff are supporting the municipalities to provide. So that's just that second headline responsibility. They're supporting all of the communities in delivering that headline responsibility. And then there also were some external partners who were listed as helping some of these towns deliver their services. So some of these external partners include the emergency response, fire and building departments, and different municipal departments throughout the towns in the shared service arrangement who are helping to deliver these environmental public health services. So again, just looking at the capacity and expertise and noticing that it looks like the shared staff capacity and expertise is lower, but moving forward, that will be greater because of the increased availability of your shared inspector. And then the far right-hand column in that bottom left figure where it says met community needs and then mostly or completely. It's indicating the number of municipalities that indicated that their needs were being mostly or completely met by their individual towns, the shared service staff, and any external partners. And for the most part, most of the communities indicated that their needs for environmental public health were being met, which is really great, and it's showing that you all are utilizing your resources to meet those phase 1 performance standards and deliver environmental public health services. Are there any questions about this slide? I know it's kind of a lot to look at.
Very busy.
Okay, the next one that I'm going to show is assessment and surveillance. Okay, there we go. It just takes a second to load. So the reason that we're showing this foundational capability is it's showing something that the SSA is providing to all of your communities that isn't being done locally. And so we can see that overall local public health entities and MPHN dedicated 4% of total spending and 2% of staff working hours to assessment and surveillance services in fiscal year 2024. And that the shared staff were really providing these services to the communities, and the responsibility fell on the shared staff in MPHN and not on the individual municipal health departments. And then I just want to note that the first 3 headline responsibilities that are listed, where it says that MPHN is providing the services, that's really where your MPHN epidemiologist and shared staff in MPHN are expected to provide services. And a lot of these are things that Victoria was talking about earlier in the Epi report, like providing MAVEN coverage and tracking diseases. And this is stuff that the MPHN staff have high capacity and expertise to deliver, and they're delivering to all of the communities quite well. And then the bottom 2 headline responsibilities, where it shows that the shared staff are not delivering these services, that's because these are things that are done at the state level or are done by like town clerks. So the maintaining of vital records infrastructure, that's done by city or town clerks, so it's not expected to be done by local public health staff. And then the last one, of maintaining a laboratory infrastructure, that is done by the Department of Public Health Laboratory Services. So again, that one is not expected to be done by local public health staff. Are there any questions about this one, or is there any insights that folks want to express about this slide? Again, I know it's a lot to look at, and there is a slide that looks like this for each of the foundational areas and capabilities. So if this is something that you're interested in looking at in more detail, after this meeting, Catherine will have the data and we'll be able to send it to all of the municipalities. And if you want any support in interpreting this data or looking at it in more detail, you're welcome to reach out to the subject matter experts from MHOA by submitting a technical assistance request, or reach out to me from BME, and we're happy to meet with any of the municipalities individually to talk through this data and how you may be able to use it in planning moving forward. So this slide is just an overview and provides some general information about your data. So this first box is just highlighting the 2 headline responsibilities / foundational areas that most closely align with the current performance standards. So those are environmental public health and communicable disease control. So that's more just informational, but those are the 2 that most closely align with the performance standards. So any resources that you're dedicating to these foundational areas are also meeting the current performance standards, and then also aligning with these foundational public health services foundational areas. And then that second box is highlighting 2 foundational capabilities where there were some municipalities in your shared service arrangement that had reported having really high capacity and expertise in those areas. And then there were other municipalities within MPHN that reported having really low capacity and expertise in those areas. So those include community partnership development and organizational competencies. So the thought here is that you all may be able to leverage the expertise of those folks in the communities that really expressed having high expertise and leverage that expertise to support the communities that expressed having lower expertise and capacity in these areas. And then the 2 foundational areas and capabilities where overall among the shared staff and the local municipal staff, there was a bit lower capacity and expertise are chronic disease and injury prevention, and then accountability and performance management. And I do want to note that the chronic disease and injury prevention one, there have been strides from MPHN since fiscal year 2024 to address some of the headline responsibilities in this area. So if this data was collected again today, it would likely look different, and this might not be an area with lower capacity and expertise. And then the foundational area where there aren't as many services being provided by local public health across Massachusetts is in maternal, child, and family health. And this is because maternal, child, and family health hasn't historically been the responsibility of local public health. And so this isn't reflecting poorly on you in any way, shape, or form. It's just an observation that there may be other providers in your communities who are doing this work that MPHN can collaborate with and build upon, which I know you all are already doing. So a lot of this work is already in motion since fiscal year 2024. So this slide is just showing, it's still loading, sorry for folks on. Here we go. So this is showcasing that you all completed the data collection period, and then the next step for this data in fiscal year 2026 is to use it in your SSA planning, which MPHN is already thinking about in developing your PHE work plan and thinking about how to utilize this data to really support your shared service arrangement. And then in 2027, the hope is to use it for capacity building. And there are 3 data to action toolkit items that have been shared with the MPHN shared staff on Smartsheets that just provide additional resources on how to think about this data as you're moving forward and planning for the upcoming fiscal year. And as I mentioned earlier, there's a support team available to any of the communities that may want to dig into this data a little bit more. And this support team includes folks from the Office of Local and Regional Health, as well as people on my team from BME Strategies and subject matter experts from MHOA. And then that's all the data and slides that I have to present to you, but I'm happy to answer questions. And then, as I said, Ileana is also here from DPH if you have any questions that she can answer.
Very talkative group today.
Okay.
Thank you, Kyla.
Just stunned faces, that's all we have.
Yeah.
That's kind of how Steve and I looked when we first saw it, too.
So that's a ton of information, and I've looked at it twice, and I still struggle with the information. So we will definitely share that information and try to absorb as much as you can out of it. It's not something you can deduce any plans from within 5 minutes of viewing it up during this meeting, but spend some time with it. We'll share it with you. Moving on. Thank you, Kyla. Any announcements to be made from any folks in the MPHN? Catherine, thank you.
I have one announcement. I want to recognize that Victoria was given an award, which will be presented next week. It's by MPHA, and the award title is, let me get it right, the Local Public Health Leadership Award for those working within the field of municipal public health, and being presented to Victoria, our epidemiologist, was nominated for this and chosen, and it's being presented next week by the Massachusetts Public Health Alliance. So I wanted to make sure everyone knew about that. Our epidemiologist has been given this award for the whole state. So thank you.
Congratulations, Victoria.
Congratulations.
Nice going. Anybody else have any announcements, anything to add? It's a silent group out there today. Next meeting is scheduled for July 30th. Hopefully that doesn't interfere with too many vacations, but we'll give it an attempt. I want to thank DPH and Kyla from BME for attending, Ileana, as well as we had David from Sterling, I just wanted to point out, showed up during the presentation, so thank you, folks. That makes, I think, 11, which is a great number for attendance than we've had in the last couple of meetings, so thank you for that. We have our two in-person folks, which was nice to have. Nice to see Hubbardston. Haven't seen Hubbardston for a while. Kathy Hansgate from Hubbardston. So if there is nothing else to add, I would entertain.
Motion to adjourn.
Second.
Thank you. I hear a motion and a second to adjourn.
Didn't hear a second.
I heard a second.
I did.
Okay.
I seconded it.
All in favor?
Seconded from Ruth. Thank you,
All in
folks.
favor?
See you, Phil.
Stay healthy. We are adjourned.